Welcome. I'm Liz Arrington with the OHSU Foundation. As we look to the future for the OHSU Center for Ethics in Healthcare, we celebrate the inaugural director, Dr. Susan Toll, who will soon be retiring after 34 years of incredible leadership. Dr. Toll was one of 4 original founders for the center when it was established in 1989. Dr. Toll holds the Cornelia Hayes Stevens Chair. Her tireless energy, unwavering principles, and dedication have built a center for ethics we can all be proud of.
This has been the most remarkable year the center's ever had. When we look at our accomplishments and the impact report, I'm so proud of every member of our faculty and our staff committed to mission and doing more through collaboration, synergy, growth, and a ripple than I ever thought possible. We have some very strong young faculty who are taking their programs far beyond anything I'm capable of. Let me tell you about our newest faculty member, Dr. Christine Maloney. She has learned about POLST over the past 2 years and is doing things in whole new ways to reach out to people who don't trust healthcare, who are disempowered in our system, or whose first language is not English, and helping us go far beyond where we've been with our educational materials, making them understandable and empowering. Dr. Tyler Tate is such a gifted teacher. The Living with Life-Threatening Illness class continues to be rated by almost every student as the best course in medical school or college. He has a passion, a vision, and skills for building an infrastructure in the Ethics Center that will allow us to educate future healthcare ethics leaders by having a robust base that includes the humanities. He is expanding a scholarly lecture series, and he is a remarkably sought-after speaker nationally and internationally. Cliff Coleman is an outstanding teacher. He changes curriculum, improves it, studies it. His passion is health literacy, clear language, and he fights ageism and he fights racism. He is also extremely heavily sought after as an international speaker now in health literacy. His heart is called to do more with what he studied when he got his master's in public health, research, and specifically studying communication skills curriculum and how to make it better, to be able to improve it not only here, but roll out a model across the country. Dr. Katie Stowers is a gifted teacher in a whole new way. She's a teacher of teachers about how to give serious news, to respond to anxiety, to support caregivers. She's one of the major leaders in the National Vital Talk organization, developing curriculum for them used across the country, but coming back here and building something beyond that, program building and infrastructure building, so that all of those gifted teachers who are teaching people how to teach the next generation of trainees can move forward, move out. In synergy with Cliff Coleman, they're building something far beyond what anyone else can really do. And once they study it, refine it, and share it broadly, implications are enormous for the entire rest of the country. My family has benefited from the programming compassionate communication. 2 years ago, my sister Margie was in so much pain. She was told that she was ineligible for a knee replacement because she was immunocompromised. She was given a knee brace, a walker, and narcotics. She could barely get from her living room to her kitchen, and she couldn't get upstairs. 2 years later, using the principles of RELY, resilience and empowerment in later years, she learned that she needed to move and she needed a regular pool program, and she had the resilience to adapt and do it. She now does not have pain medication, does not have a brace, does not have a walker, regularly goes to the pool, and teaches Tai Chi. Too many people do not have this incredible transformation in their quality of life because they are dismissed, demeaned because of ageism. We need this for many more people, and the program in compassionate communication needs to grow and serve all of us in our time of need. As I look to the future, I am so struck by the gifts, the talents, the passion, the vision of all of our faculty. They are so capable of taking each of their programs to a level beyond what I can do. I'm convinced that it's the right time to pass the baton to the next generation of leaders because they are so ready to take the programs upward to a whole new level. When we first set out together to build the Center for Ethics and serve the people of Oregon, who knew we would build programs replicated across the country, across the world, and make such a difference in the lives of people everywhere? What we have done already will matter in 100 years and more. I am so grateful to each and every one of you as I think about passing the baton to our incredibly capable visionary faculty and becoming the center's most enthusiastic community volunteer after 34 years of leading the center.
One of the center's most innovative and far-reaching programs is the POLST program. POLST stands for Portable Orders for Life-Sustaining Treatment. We will now hear from the newly appointed director of Oregon POLST, Dr. Christine Maloney.
Earlier this year, I received the honor of being named the medical director for the Oregon POLST program. After 2 years of mentorship with Susan Toll, it is a role that I feel both ready and eager to assume. For Oregonians who are nearing the end of life, POLST provides them with a patient-centered, voluntary approach that elicits, documents, and honors their wishes for medical care. POLST is used widely across the state by Oregonians with advanced illness or frailty. In fact, over half of Oregonians have a POLST in the registry at the time of death. Having said that, and as we look towards our future, we are committed to providing equitable access to POLST, regardless of the region of the state, cultural background, or primary language of the Oregonian in question. With this in mind, we have worked hard to create culturally appropriate translations of educational materials. Now, our focus is on dissemination. Our goal is to provide those materials at no cost to the clinics who need them most. And as we think about how we need to function, it is crucial that we maintain financial independence from industry sponsors. If we don't have that financial independence, we will lose the public trust. Indeed, dedication to financial independence has been and remains a core principle of the POLST program and the Center for Ethics.
Oregon's endowment is clearly key in terms of its success as a state program. No other state has an endowment. No other state POLST program has an endowment, and most state POLST programs are struggling because their financial security from year to year is in question. Our financial security base is based on a line item budget from the state legislature. So the endowment has enabled the Oregon POLST program to become the exceptional model and to contribute in research, in education, in outreach to other states, really I wish we had the same type of endowment in West Virginia.
At its heart, POLST is about helping patients make informed decisions about their healthcare and then providing them the means to empower them so that those decisions are recorded and then respected by the healthcare system. All Oregonians deserve to have access to that equitably, and that is our mission as we move forward.
Dr. Tyler Tate is the Director of Professionalism and Comfort Care. He teaches one of the medical school's most beloved courses, the Living with Life-Threatening Illness class. He is also building a network of new academic partnerships to address some of healthcare's most pressing problems.
Living with Life-Threatening Illness is an incredible course that takes 16 first-year medical students and pairs them each with a patient teacher, a patient who has a life-limiting or life-threatening diagnosis of themselves. And through a series of rich conversation and educational activities, we teach these students what it means to care well for a person who is at the end of their life. As I look to the future for this course, we'll be adding in more didactic information about health disparities and end-of-life care in the state and region, and infusing the course with even more medical humanities and medical humanism in order to help these students learn that at the end of the day, to care for someone who is suffering is never just a science. It's also a moral art.
I took the Living with a Life-Threatening Illness course my first year of medical school. And when people would ask how medical school was going, I would really only talk about that course. I think it absolutely changed the way that I understand medicine, how I understand patients, and how I hope to serve as a clinician in the future. And I think it helped me see humanity in a very different way as well. We all came into the class with different experiences from our own lives, various understandings of what it means to have a life-threatening illness or have your life changed in such a way by an illness or a new diagnosis that you receive. But I think when you're meeting someone for the first time who you don't know and whose life course has been changed, it's a completely different way to connect with them. So having a patient teacher who can tell you about what this disease means to them, how it's changed their visions and goals that they have for themselves, how it's changed the lives of their loved ones is an incredible experience that I will take with me for the rest of my life. And I think I have a better sense of empathy, a better sense of what patients need, a better sense of my own shortcomings and things that I need to work on in order to connect with patients over their own stories and bring out, humanity in all of us and find ways to be a better doctor and help people feel like the best version of themselves and maintain a sense of self despite these very difficult diagnoses.
I'm incredibly excited about what we are doing with the Kinsman Bioethics Conference. This past April, we brought in Dr. Patrick Smith from Duke University to speak about health equity and ways that the American healthcare system can become more just. For the last 2 years, we've piloted the Oregon Bioethics and Humanities Colloquium, an academic lecture series bringing rich conversations about bioethics, the medical humanities, to students, scholars, and the public across our state and region. Now, due to generous support and sustained interest, we are formally launching and have OBHC and have brought Dr. Lainey Friedman Ross from the University of Rochester in September to be our keynote speaker. She gave a series of talks across OHSU. And in addition, we partnered with the University of Portland, Dr. Dan McGinty, as part of the Dundon Berchtold Institute, to have Dr. Ross speak there to a whole group of high school students and college students to tell them about what exciting careers they could have in bioethics, the medical humanities, and healthcare. When I think about the future of OBHC, I look forward to bringing more voices to the table, expanding access for educational opportunities for the public, for students, and to bring in scholars from across the Pacific Northwest as we build bridges between OHSU and the other major universities in our state and region. And we need this because there are so many tough problems that we need to try to solve in healthcare, and that medical ethics is a critical tool to achieve this task. So I look forward to the future. It's going to be bright, and I think OBHC will be an important vehicle for change.
The program in compassionate communication has grown so much in recent years. Next, we will hear from Dr. Cliff Coleman, the Doris and Mark Storms Chair in Compassionate Communication, and Dr. Katie Stowers, the Ronald W. Nato Director in Serious Illness Education. They will be sharing their excitement about the program and its future. They'll also be joined by Dr. Madeline Boyd from Klamath Falls and Dr. Gary Kyoto, one of the center's original founders.
This has been a really exciting year for the program in compassionate communication. We've grown in three really important areas. The first is with our medical student testing. This year, we taught our largest class ever. They keep getting better and better, and we keep having to raise our expectations. The second is with our communication teaching here in the Portland metro area. We taught 25 workshops this year and had to hire on 2 new coaches to meet the increasing demand. The third and probably the most exciting growth point is into our rural communities. We have partnered with Klamath Falls this year, training 2 of their local faculty to be communication coaches who will continue to teach with us.
This training has been incredibly important for our group of residents and faculty down here in Klamath Falls, Oregon. We're about 5.5 hours south of Portland. We knew we needed some type of serious illness communication training, something that could be a shared language between faculty and residents. And the Center for Ethics was able to provide us with skilled trainers to help us develop those skills so that now this is a sustainable model that we can use with every residency class going forward and really improve our patient care.
I'm really excited about some innovations that the program in compassionate communication has allowed us to make both locally and at the national level this past year. Locally, we conducted a curriculum mapping project for the School of Medicine where we identified some areas where our medical students weren't being taught well, specifically areas around ageism and care for people who have disabilities. And we've been able to fill those gaps with some mandatory trainings now that are going to help improve care for those populations. And at the national level, we recognized that a need for a conversation around communication equity in care for older adults and for racial and ethnic minority populations who've experienced educational inequities. And so we've been able to expand our conversation to the national level through some presentations and publications, which have helped us start a much bigger conversation that's going to carry us forward.
The successes from the past year have taught me personally a lot about where I think we need to head forward for this next year. Each new training, each new group we've worked with has taught me more and more, and also at the same time opened my eyes to more questions about how do we do this better? How do we translate this to bigger audiences that I don't necessarily have the answers for? I really believe in the training that we're doing and that it is making a difference, but I don't necessarily have the data to support that to really be able to broadcast this to larger audiences and prove that what we're doing matters.
Katie, I think you hear it from our learners, or the students and the residents and the fellows, that they love this stuff and that they're hungry for it and how important it is. And for us to be able to share that with a broader audience, people across the state of Oregon and other states, we need to develop that evidence base that shows that not only what we strongly believe in actually matters, to create that evidence that we can then use to drive policy and help other institutions adopt what we're doing here, which is so innovative.
And being able to take the programming that we're providing for physicians in training right now and expand it to a larger audience of nurses, social workers, and other professionals who are working in healthcare.
Anxiety in the dental treatment environment is very common. 36% of patients report mild to moderate anxiety. 12% report dental phobia, which is a psychiatric diagnosis that is far more debilitating This leads to avoidance of dental care, where small problems that could be addressed and prevented or treated with very moderate treatment escalate to very severe problems. The dental treatment team certainly needs enhanced communication skills and training in order to provide maximum benefit for patients. This optimally is an interdisciplinary approach where future dentists, physicians, nurses, and others on the treatment team are communicating together more effectively with those patients. It will benefit them greatly.
Bringing that humanity into the encounter with your healthcare team not only is going to improve the experience of patients, which we know we can improve on, but it's going to improve outcomes. And we're going to achieve this through compassionate communication, being clear in the way we communicate, anticipating people's communication needs, and giving them the information that's useful and usable in the moment.
Any person who has encountered the healthcare system knows that the system was not made to benefit the patient. Even the way that healthcare professionals are trained almost trains out the humanity of through their training. What Cliff and I are trying to do through our work together is put the humanity back into medicine.
You know, this training that we are developing here is really unique, and only a handful of other schools are trying any of this, but none of them have the benefit of the combined approaches that Katie and I bring.
I believe, and I know you believe, that bringing our two expertise together are really the way that we're going to make a meaningful impact in changing healthcare for patients and their families.
Plans are in place for what promises to be a very exciting future for the Center for Ethics, one that builds on Dr. Toll's remarkable legacy and continues OHSU's leadership and commitment to the work to make healthcare better for everyone. We'll now hear from Dr. Marie Chisholm Burns, Provost at OHSU, about what the future holds.
The Center for Ethics in Healthcare has played a vital role at OHSU for more than 3 decades. In that time, guided by the vision and passion of Dr. Susan Toll, the center has achieved more than anyone imagined possible. We are immensely proud of the center at OHSU. We are also deeply grateful to those who have so generously supported the center's innovative and transformative programs. After 42 years at OHSU, Dr. Toll has announced her retirement. She modeled the best in compassionate care, and her leadership has inspired all of us to reach further and higher when thinking about how we deliver healthcare to our patients and their families. Susan looks forward to spending time with her friends and family and continuing her friendships. Susan, I, along with everyone here at OHSU, sincerely thank you for your service. I'm very pleased to announce that Dr. Katie Stowers will be assuming the responsibility of interim director during the transition period while we conduct a national search for a new director. Dr. Stowers' commitment to the center is outstanding, and we are very excited for this new chapter in the center's extraordinary growth and evolution. Please join me in congratulating both Dr. Toll and Dr. Stowers.
Thank you for your interest in the OHSU Center for Ethics in Healthcare. The center is 96% philanthropically funded by people like you. Thank you so much for partnering with us to make healthcare more just, respectful, and compassionate. You power our programs, and we are very grateful.